This is Talk to Kedi, sharing knowledge, liberating minds. Hello, my people. How are you all doing today? Thank you so much for tuning in to another edition of the number one educative online broadcast, Talk to Kedi. It is time to talk to Kedi. Yes. Today we will be talking about a very sensitive topic. We'll be talking about a silent killer disease that has killed thousands, if not millions of people all over the world. Our topic for today is high blood pressure, hypertension. High blood pressure, hypertension. What is high blood pressure? What are the causes of high blood pressure? Can high blood pressure be prevented? Can it be treated? Who is at risk? What are the symptoms? How do I know if what I'm experiencing is one of the symptoms of high blood pressure? This and many more are the things we'll be talking about on today's edition of Talk to Kedi. My name is Sarah Adenowo. Thank you so much for tuning in. Please sit back, relax. This is the part where you share the link with everyone. This is the part where you remind everyone you know whether they are battling with high blood pressure or not. Prevention, they say, is better than cure, right? So this is the part where you invite everyone, please tune in to Talk to Kedi. Let us learn about high blood pressure. Now, to do justice to this very sensitive topic today is our very own articulate, what should I say? Okay, our own Mr. John Kolawole Cole, am I right? You're welcome, sir. Welcome to Talk to Kedi. How do you feel being here today?
Wow, I'm very excited.
Ah.
And it's a great privilege to be here.
Okay.
And I'm fully ready
Oh.
to pass the information
Mm-hmm.
about the topic
Mm-hmm.
and how we can maximize the Kedi products in order to take care of this.
Oh, right then, in case you're tuning in for the first time, say, okay, what's going on here? Or you don't know Mr. John Cole, okay? So let him introduce himself to us quickly so that we can all be on the same page, right?
Thank you very much, ma'am. Once again, my name is Coach John Kolawole.
Yeah.
Before this wonderful company, I was once a frustrated student.
Oh, okay.
Suffering and smiling.
Oh.
I look at the future, it was just blinking like a desktop. So hoping that one day this blinking future will be stable. But the risk is very great. So that was when I started praying to God to show me what I can do to change my life. The day I pray, I know, but the day God answered my prayer, I never knew. Somebody came across my path and told me there's something I can do that can transform my life. Within 2 to 4 years, I look at it. Whether the person is lying, I just give it. Let me give it a try. But to God be the glory today. I return all the glory that through this wonderful company, my life has changed. And my year-born generation can never know or test poverty.
Wow.
If I can do it, everyone can do better.
Yes.
So thank you.
You are welcome, sir. Yes, Mr. John Cole is one of our seasoned TCM consultants. He's one of our dynamic lecturers. Yes, you can see his givings. Yeah, he's one of our lecturers and he's indeed a passionate network marketer. Yes, I'm sure you will learn so much from him today. He will be taking us through our topic, high blood pressure, hypertension. Please sit back and go nowhere. In case you're tuning in for the first time, okay, permit me to introduce to you Talk to Kedi. It is our weekly broadcast coming to you from the stable of Kedi Healthcare Industries Nigeria Limited, the leading provider of quality healthcare products and services in Nigeria. Now, this broadcast comes your way twice every month on Thursdays by 12 p.m. Okay, so please make it a date with us and trust me, you won't regret it. Okay, so today, let me tell you one more thing. On this broadcast, we discuss so many issues bordering on health, business, and of course, other contemporary issues that have the capacity to affect your health and your business. Okay, so today we will be talking about high blood pressure. If you have questions, The comment section is open for you. That is how you get to talk to Kedi. Okay? As we talk to you from the studio, the comment section is all yours. Make use of the comment section. You have questions, you want to contribute. Okay? You are a Kedi distributor, you have handled the case of high blood pressure with Kedi products. Why not? Make use of the comment section and let us know how did you go about it. I mean, what was the result? Okay, or if you have been treated with Kedi products, you treated hypertension with Kedi products. Make use of the comment section and tell us. We would like to read from all of you. Okay, whether you're a consultant or you use the products, we would like to hear from you. Make use of the comment section and talk to Kedi. Now, as usual, let me run you through the history or a few research studies about high blood pressure. Now, studies have shown that there were more than 28 million cases of hypertension in Nigeria in 2020. More than 28 million cases of high blood pressure in Nigeria alone, not all over the world, in Nigeria. In year 2020, rising from it was 4 million in 1995. In year 2020, it was 28 million cases. Now, studies also shows that the prevalence of hypertension in Nigeria is about 38.1%, which amounts to 76.2 million people. I'll explain. That means 76.2 million people, okay, out of an average population of 200 million people are battling with high blood pressure in Nigeria. Now, researchers have also discovered that the rate is increasing faster in women. What do we do? The rate is increasing faster in women than in men. That's another one. Then another one, the one that shocked me of all the studies that I went through when I was preparing for this broadcast, the one that shocked me, please listen, is the part where they said more than half of the people battling with this condition do not know yet.
Yes.
It was, in fact, every other thing I read, I was like, okay, I've read. But when I got to this part, I paused and said, wow. It said more than half. That means it's possible that you have it, but you don't know. So that is why we should come together to learn about this silent killer disease. Okay? Half of the people that are battling with this illness do not know yet. They only get to know when something happens and then they visit the hospital and they are diagnosed. Half of people battling with this ailment do not know yet. Okay, so they don't get to know until it becomes worse or even lead to death. I guess you now understand why this topic is very, very important. At some point in time, we must have probably seen some people or heard about people who battle with this illness. Some lost the fight, but some didn't. Okay, so that's why we thought it wise to talk about this very important topic today. I will not be wasting time. Quickly, I'll be handing over to Mr. John Cole to do justice to this topic. We are all here to learn from his wealth of experience. But as you watch, if you have contributions, please make use of the comments. I will read them out so that every other person can also learn from you. Don't forget, no man is an island. Is that not true? Okay, thank you. So quickly, I will hand over to Mr. John Cole as he takes us through high blood pressure, hypertension. Mr. John, are you ready, sir?
Yes.
Fully ready. Okay, so for easy comprehension, because I want all of us to be on the same page. Okay, tell us what exactly is high blood pressure, and at what point can one's blood pressure be considered high?
Thank you very much.
You're welcome.
Firstly, I would like us to take note of the word blood pressure. At times, I've heard people saying, I don't have BP, I don't have blood pressure. Everyone has it. Without blood, we can't survive.
Sure.
So, blood is very essential. Now, the word pressure coming together, blood pressure. What is blood pressure? This is the measurement of force the blood used to push around the circulatory system. Now, what is circulatory system? it comprises of the what? The heart, the arteries, and the capillaries. And the catalyst of blood pressure is the heart, majorly. The heart. How does it work? Now, the heart is a muscle, it's a powerful muscle that pumps blood in and out. 247, it never stops as far as we are breathing. So it never stops. So this heart has 4 chambers, 2 on the right, while 2 on the left. So the right, we call it the what? The right atrium. So the second on the right, we call it the right ventricle. On the left, we have the left atrium and the left ventricle. Now, how does it work? The blood moves from the right atrium down to the right ventricle. Now, it pump the blood to the lungs to be empowered, because the blood coming, they are lifeless. They are deoxygenated blood. They are lifeless. So it needs power. It needs oxygen. Oxygen is needed for this blood. So the right atrium pump it to the what? Right ventricle, while the right ventricle send it to the lungs, where the lungs convert it to oxygenated blood. And waste, from that very point, the waste is being dispelled. The lungs will send it right to the what? To the right ventricle. From there, the right ventricle will send it to the left ventricle. Now, from that left ventricle, then it pushes the blood to the heart through the what? The largest arteries of the heart or the body system entirely, called the aorta. So it's just like a tree with many branches. So now, from there, the heart will push the blood back to every part of the body system, starting from the major organ of our body. One of the major organs is the brain, to the smallest tissue in our body, that is the toe. So then that continues, the cycle continues for years, as long as we can live. So at what point can one have high blood pressure? We have a range. You cannot determine your high blood pressure without the checkup. You need to what? Undergo a checkup before you can know what? Determine it. Your blood pressure, whether it's high or the state at which it is currently. So you can't what? Get the heart rate without the checkup by using the what? The gauge, the monitor for the checkup. And now, there are 2 numbers which you will experience while using this monitor. We call it the systolic and the diastolic. The systolic is when your heart beat is contrasting, contracting together. So you get your systolic. While the diastolic is when your heart is at rest between the beats. It's at rest. So that's what we call the diastolic. Now, these are the 2 numbers which you can use to what? To get whether you have high blood pressure or not. And we have 5 of these in range. That is the measurement. We have them in range from the systolic, from less than 120, over diastolic, less than 80, then it's normal. And these numbers are measured in millimeter of mercury. We call it millimeter of mercury. So 120, less than 120 over less than 80 is considered normal, according to World Health Organization. Now, moving down from 120 to 129 systolic over less than 80 is considered elevated high blood pressure. Elevated. You can still, it's still close to the normal, but the first stage of hypertension starts from 130. 130 to 139 systolic, over 90 above, over 90 diastolic. So that is stage 1 hypertension. Now, stage 2 hypertension is from 140 to 149. We call it what? The stage 2, whereby the systolic is over above 90. That is the stage 2. Then the most critical part of it is the what? Third stage, which we call the hypertension crisis. So at this stage, the systolic is above 180. 180 over diastolic 120 over 120. So at this stage, it has become critical. So with this range, we can what? Easily tell if we have hypertension, and this hypertension is even without any specific symptom yet. So let me stop there.
Because that's my next question I was going to ask. So that someone watching will not say, hey, I'm feeling something here. Does that mean I have a high blood pressure? Or I'm feeling something here. Does that mean I have, so I would have thought that there are general symptoms that one should look out for. Okay, that if you're experiencing this certain symptoms, then you're probably at risk. Do you understand? So are there symptoms like that?
Yes, thank you very much. Generally, high blood pressure has no symptom. That is why it is considered the silent killer. So many people can live with it for years, for 10 years, 20 years, and without any symptom yet. And while checking your blood pressure, you will discover that it may fluctuate.
Yes.
So it depends on your position at that very moment. Whether you are walking, or you just finished an exercise, or you are just excited. So it pushes your blood pressure up. So now, before we can diagnose what exactly, at what stage this person has gotten towards hypertension or high blood pressure, we must take this result, this test, for 2 to 3 days consecutively. So before we can conclude that, oh, there's you have a what? Hypertension. You are hypertension patient. So there is no symptom of hypertension except when it has become hypertension emergency. So that one is the person is already down already. So and once it's done, then different kinds of symptoms will be emerging, like what? Pains all over the body, like vision, blowing, or eye problem, like chest pain, like nausea, like vomiting. So all these, they are symptoms at the critical stage.
Okay, thank you, sir. In case you're just tuning in, this is Talk to Kedi, where we share knowledge and liberate minds. Our topic for today is high blood pressure, hypertension. In case you're just tuning in, and Mr. John Cole has been doing justice to this topic. Well, let me pick you up. If you have questions, you have contributions. Okay, our teaser for today, very simple. As a Kedi consultant, have you treated hypertension with Kedi products? If yes, share your experience with us. That's part A. Part B, okay, you're not a Kedi consultant, but you have been treated. You have been treated with Kedi products for hypertension. How did it go? Share your experience with us in the comment section. We want others to learn from you. Now, sir, let me pick you from the last thing you said. You said one of the things he said, when you're excited, you can possibly push your blood pressure up, okay? Or when one or two things happen to you. So now, this is my question now. Before checking, are there things one is supposed to pay attention to, like maybe drink water before you check it, or if you have stressed yourself, please calm down. You know, what are those things that one should check or one should do before doing that check so that it can be accurate, you know?
Yes. Thank you, ma'am. Actually, there are steps one needs to take before you can get the accurate measurement. Walking down, maybe you are coming, you are excited from, or you are just perform a little exercise. Then, when you get to the point to check your blood pressure, you need to sit calm for like 5 minutes, relax. And if your bladder is filled up, you need to empty it. You need to empty it. So then relax. And the checkup will be done. And when you are doing it, don't just keep your hand very straight to your what? To your heart. Very straight to your heart. That is the position should tarry. Then the test is good to what? To start. So by so doing, you get your what? Your blood pressure.
Okay, all right. You have heard it from Mr. John Cole. Now, my next question is this, sir. How does one know the type of hypertension? You talked about different types, about 3 or so. So, how does one know the type? How do I know the type that's gotten to? Am I on stage 1? Am I on stage 2? You know, now, are there peculiar symptoms to each type? Just like okay, for stage 1, these are the things you will likely see. For stage 2, these are the things you will likely see. Are there peculiar symptoms like that? If not, how does one know?
Thank you, Mom. The type, there are two things: the type and the range.
Okay.
The one I mentioned the other time is the range.
Range. Okay,
yes.
So tell us the type.
The type now, we have two major types of hypertension. The first, we call it the what? The primary hypertension, which we can also call it the essential hypertension.
Oh, okay.
This one, the majority of people with hypertension falls on this category of this type of hypertension, because it usually comes with no symptom at all. No symptom, you can be doing your daily routine without feeling anything. But the second come with symptom, that is the what? Secondary hypertension. At this point, there is a particular condition to point that, oh, this is the cause of, but primary has no specific cause. We just what? Change our what? Our lifestyle. That's all. For primary hypertension. But for secondary hypertension, there is definitely a cause. And the cause for secondary hypertension is mostly it's damage the organ, like the kidney being damaged, like what? The heart disease, the coronary artery disease. So these are and most people that experience chest pain, eye problem, numbness of the hand, vomiting, and so on. These are symptoms of the secondary hypertension patients. So they always fall on this what? Second type. And also, in addition to the types, we also have gestational hypertension. That's for pregnant people. So when they are pregnant, possibly it shoot up. And we also have what we call white coat hypertension. White coat. That means such a person getting to the what? The clinic or the hospital, after checking, it will shoot up. Getting home, it will come down. So that's white coat. And we have the masked hypertension. That is going down in the hospital, going up.
Oh.
So this mask. And we also have the resistance hypertension. That is using medication and such medication still shooting it up. That's resisting the effectiveness of that medication. That's what resistance hypertension. So I think these are the little types.
Yes, thank you, thank you, thank you. This is Talk to Kedi, and our topic is high blood pressure, hypertension. If you have questions, this is the time to start sending your questions in. In the next few minutes, I will be going to the comment section to take your questions and, of course, your contributions. So please make use of the comment section. I would love to read from you. Don't forget our teaser for the day. As a Kedi consultant, have you treated any of your patients with Kedi products? And what was the result? Okay, and you are not a Kedi consultant, but you have been treated with Kedi products for hypertension. Please make use of the comment section. I will be taking your comments in the next few minutes. Okay, so now my next questions are: prevention, they say, is better than cure. So can high blood pressure be prevented? If yes, how?
Thank you. High blood pressure can be prevented.
Okay, good.
And that is the good news about it. And how can you prevent it?
Okay.
Is by changing your lifestyle and being more active.
Okay.
So these are the two major ways to prevent high blood pressure. Because now, cut your intake of sodium, that is salt, because it shoots high blood pressure, and increase your potassium intake. Your potassium, it energizes your muscle, and it makes your heartbeat to be strong. That's potassium. And where can you get it? In fact, from the food we eat, like avocado pear, there are a lot of fruit that contains what potassium. That's when you are taking, and also keep active. That is exercise. Always exercise and cut your intake of alcohol, alcoholic or any beverage that contains alcohol, and also reduce your weight management, obesity. So cut it down. That's why all this their lifestyle, that by doing it you can prevent hypertension.
Okay.
Thank you.
All right, then. Okay, so from your clinical experience, to now tell us, what are the risk factors? Okay, what are the risk factors of high blood pressure?
The risk factors of high blood pressure. Firstly, age. Yes, age.
Please explain.
Now, when we look at the older men from age 55, you cannot compare even their strength with the younger one with 25 years. So the young one are more active. Why the age one? They are less inactive, especially going towards age 65, 70. We discover that they cannot do those things they used to do before. So, and that will be making their nerves, their arteries to stiff because they lack exercise. So by so doing, their blood pressure goes up. And also another risk factor is race. Yeah, it is estimated that the black people get hypertensive than the white people.
This is a racist disease.
It's a great disease indeed. So than the black people. So why another is genetic. That is a family, the history of one's family. Is there anyone in the family that has contacted this or has this symptom of high blood pressure, then there's a what? There's tendency for one to be also be part of it. And also another risk is um, gender. Yes, gender, men and women. So women are mostly they get their hypertension when they got to the what? Their menopause age.
Okay.
So that's when they are, because the estrogen there is no more, or possibly is going down, is decreasing. So these are the what are the risk factor of what? Of having, or someone with what? With any medical complication, like a kidney problem, can possibly um, be a what? Victim or a patient of what? High blood pressure. So thank you.
All right. So, sir, does that mean that the younger ones are not susceptible? Because when you were talking about age, you focused on the elderly ones. Does that mean the younger ones are not susceptible to this killer disease?
They are. The younger ones are susceptible because of what? Their lifestyle.
Okay,
like intake of junk foods,
okay,
too much sodium in their food, consumption of what? Alcohol, and the likes. Once they are not able uh, exercise, they are less active, so they are susceptible also. But the rate of the older ones is more, yes, than the young ones.
All right, then this is Dr. Katie, sharing knowledge, we're liberating minds. Yes, I will soon be moving to the comment section. Are you ready for me in the comment section at all? Okay, our topic is still high blood pressure. High blood pressure. I will soon be going to the comment section to take your questions and your contributions. If I had to drop your questions or your contributions, please make use of the comment section before I get there. Now let me take this question because I know many of our viewers will know, okay. Which KEDI products can I use? Does KEDI have products for hypertension then? With all of these things you have said, does KEDI have products for hypertension? If yes, you, sir, as a consultant, have you used them? Charity begins at home, not you. Have you administered these products on your patients? And what was the results? Let's hear from you.
Thank you. KEDI has fantastic products for high blood pressure, and the products are very effective. And based on experience, I have used these products to administer to my clients, and I came about a fantastic results. So what are the products? Number one is what is reishi. Reishi take care of what? Anything high blood pressure. Not only that, but it remove the plaque in the blood vessels. So, and secondly is cordial jelly. Actually, when I used reishi, often I don't use cordial jelly. When I use reishi, I don't use cordial jelly because cordial jelly and reishi works together. And I look at the ingredients of cordial jelly and reishi and discover that most ingredients are woven together. So, and another product is Cardi Beta. Cardi Beta. Cardi Beta take care of the heart muscle, and it gives a fantastic result. And another product I would like to include is golden seeds. It balances the yin and yang of the body system, which is very important. For us to get a maximum result, you need to balance the yin and yang. the internal and the external organ need to be what? Be in place. Now, it's just like somebody that is not straight. You see, in health, we call the yin and yang, according to the Chinese, they believed in balancing of the body system. That is, the left, the yin, the right, the yang. That is, it needs to be equilibrium. The equilibrium must be in place. So, using body six, it takes care of all the six from inside. Then lastly, the BCM massaging equipment. That is the blood circulatory machine. It's very wonderful. So when I used it, at times, I just use body six, cardibetter, and reishi, then BCM. Then at times, I use the 5 products: golden cyst, cardibetter, reishi, cordial jelly, and BCM. And the results is very fantastic. Yes, out of 100%, I can say KEDI products work for hypertension. These products I just mentioned are 95%. 95%.
I mean, that's a pass. That's a pass. So, sir, what informs, you talk about using 5 products, 4 products. Do you understand? So, what informs the difference? Is it the stage? Is it the range or what? The type? What informs the difference?
Actually, whether you use the 4 or use the 5, you get the results perfectly.
Okay.
So what I'm trying to say, by the product that makes it 5 is the cordial jelly.
Mm-hmm.
Yeah. So what I'm trying to say is that the ingredient of a cordial jelly is also a reishi. What cordial jelly can do, reishi also can do. So you can administer both inclusive, or you can just pick the reishi. But I would advise to use the 5 products for effective results. So thank you.
Thank you, sir. Okay, it's time for me to go to the comment section. Comment section is buzzing, and I need to go there like right about now. But if you are yet to drop your questions, or yet to drop your contributions, please do so now. I am in the comment section now. Okay, so the first comment I have here is from Amarachi Asuna on our Facebook page. She said, half of the people battling with this illness do not know yet. Honestly, that is the truth. And another one here is from Nasir Muhammad on our Facebook page. Said, I am Dr. Lawan. I joined you from Adamawa State. This is for you. From Adamawa State, in fact. Thank you so much, Dr. Lawan. Thank you so much. Like he said, blood pressure is the most popular illness we know. That's very correct. And then we have James Akwe on our Facebook page. Is watching from Ogun State. This is for you, Mr. James. Thank you. Now a question from Adini Okoyemi, a regular viewer. In fact, this is for you now. Yes. He said, please, doctor, kindly explain more about secondary hypertension. And we have to do that quickly because we have more questions.
Okay. The secondary hypertension is when we say the patient is down. Know fully that is secondary hypertension. So a patient with primary hypertension will not necessarily be down.
Okay.
Yes, will not necessarily be down. But once the patient is down, it is secondary hypertension, and it always points to a particular health complication.
Okay.
Like the kidney, it must have damaged the body organs before he or she can be down. So now, that is why the secondary hypertension is very complex and complicated to diagnose, to know fully what is the cause of the hypertension. That means it's very costly. The secondary hypertension, yes, at that point, because many tests will be carried out. The blood test, the kidney checkup, all the organs to know exactly where the fault is coming from. So it is very, very what complicated and a very complex hypertension. That's why at times the percentage of the primary is more than the secondary.
Okay.
And by the time it's still some persons they already has a primary hypertension. Now coupled with secondary.
Oh.
You don't know how grievous the issue will be.
Wow.
Very complicated.
Wow.
So
I thought you graduated from one class to the other.
Yes.
How come you have the two classes?
There are some persons.
Wow.
They have the two classes together.
Oh.
Their blood pressure is always high.
Oh.
But because of what? Carelessness. And nothing happened. Nothing happened. Some persons will tell you that the machine is not working. It's not working. That is not good. That how can I be having? But because they don't have a symptom yet, they are doing their normal life. So until they are done, which results to the secondary hypertension.
Wow. Thank you so much. So please, this is a wake-up call to everyone watching this video right now. Please, the fact that you do not know that you have it does not mean you do not have it.
Yes.
So please, number one, get checked. Get checked. That's the first thing. If you do not have it, thank God, I congratulate you. Please, the prevention. Do you remember the tips he shared about prevention? You just start doing those ones. And if you have it, don't worry, there's no cause for alarm. Just know the type, right?
Yes.
And then start taking KEDI products. That's my own honest advice. Please, it's a silent killer disease. You won't know you have it. So the moment it strikes you like this, sometimes it has gotten worse. Okay, so what do I know? I'm not a doctor, but at least you've heard it from the doctor. Now, Adeni Okoyemi is saying lifestyle is also one of the risk factors. Very, very, very true. Yes, Mary Nzelum on our Facebook page is a question said, what do I take to normalize the BP? I think.
Yes. What do you take? Is the KEDI product we just mentioned.
You just want it in 1 second.
Yeah. Godesis, Cordoria jelly, Reishi, and Kali Beta. Thank you.
All right. And then Tayo Adionipekun on our Instagram handle said, what are he has mentioned them. Okay, hypertension, for that's a low one.
Yes.
Yes, okay. Though it's not part of our topic, but let's just touch it a bit. Yeah.
So hypertension, once you check your blood pressure with the weight or the monitor, if it is below 90/60, 90/60, so you have what? Low blood pressure, hypertension. And this hypertension is not that common like the hypertension. Yes. And this is a process whereby the pressure of the blood is so low. It's so low. This one can even cause dizziness.
Oh, okay.
Yes. It can cause constant weakness.
Okay.
That is the person lack maybe the oxygen. Oxygen blood. Oxygenated blood.
Okay.
So, and the KEDI product to take care of it, one also is golden cis and reishi, then carry better.
Oh,
we take care of that.
We take care of that. All right, thank you, sir. Okay, we have Adeni Okoyemi. What are the complications of hypertension? What are the complications?
The complications of hypertension is what we've mentioned. The complications, one is the damages of the body organs. That is it, majorly. In summary, the damages of the body organs, like the what? Like the kidney, the brain, which can eventually lead to what? Stroke.
Wow.
Heart attack.
Wow.
Which can eventually even lead to blindness.
Wow.
Diabetes. Wow. And the likes. Expensive health issue. So these are the complications.
Oh, thank you. So, Sam, you talked about lifestyle for hypertension. Now, let's talk about the lifestyle habits for hypertension. Do you understand? So, For example, someone is diagnosed with hypertension. What are those things the person should do that's lifestyle? Okay, that the person should imbibe.
Yes. Firstly, the sodium intake.
Okay. Should what now?
Increase.
Increase.
Yes. Because sodium shoots blood pressure up. So, and also the potassium intake. And also, the person needs a what? A medication, especially to balance it.
Okay, so sir, this question from Amarachi Azuna, I want you to answer this question with your clinical experience. You said you have treated some of your patients with KEDI products for hypertension. So now you're going to answer this question with that from that angle. Our question is this: can KEDI products put an end to hypertension? So from that angle of people you have treated, now tell us.
Thank you. Can KEDI products put an end to hypertension? Yes. And no. Okay. Why do I say yes and why do I say no? Now, yes, in the sense that KEDI products has done the work. It now left for the patient to keep, because to enjoy good health takes discipline.
Yeah, you have a part to play.
Yes, a part to play, exactly. So I have a part to play. Those things you we restricted you from. Don't go back.
Correct.
So when you go back there are a lot of tendency for the hypertension.
So sir, you know what? Some people will take the medicines, they will go back.
Yes.
They will say, the medicine no work. The miracle worker.
Yes.
Just you have a part to play. No, you just tell them so that I don't blow the trumpet too much.
So you need to monitor them. Most of our patients. The last patient I treated was my landlord where I was living. So this man, after even was, I think he should be about 75 to 80 years, but yet he is still interested in treating his hypertension because it causes him sleepless nights. He can't sleep well. And why I gave him the products, taking it for 2 days, when the hypertension becomes stable, he stopped using the products. When I called and checked after him, he said, I didn't take it today. Why? He said, it's okay today. I said, no, it's not like that. Continue taking it. So there are some patients that even they are very what? We can, they says you can take an ox.
Exactly.
You can't force it. So when you minister your products to them, you can't force them to take it. Yes.
Just follow up.
Yes, just follow up with them. So that is when the blood pressure comes back, it's not
the fault
of KEDI products.
Exactly.
From the fault of the patient.
Yes.
And there's one thing I want us to take note also is before we recommend the KEDI products, there must have been products such patients has been taken before. That is the orthodox medicine.
Sure.
So don't stop it immediately. Yes. Don't stop the orthodox medicine suddenly because they are adapted. They have adapted to the body system of that patient. Now, KEDI products is just like a stranger to the body cell. So it takes time. So some persons, when they stop it, take KEDI products, it shoot it up again. And they said KEDI products is not working. But tell your patient which medication are you using. You are taking it 3 times in a day, reduce it to 2 times in a day. Reduce the dosage. So then take KEDI products as well. As time goes on, you begin to reduce, turn it to 1 time a day. Before you know, leave it permanently. Then continue KEDI products.
Okay. Wow. Thank you. Now, this question from Bene Appa. She said, Cordware jelly, Reshi capsule, Cardi Beta, and Golden Sea. So please, can they be taken at once? Okay, let me ask the next one. Say, again, you mentioned 5 products. What's the next one? I think the next is the BCM. Yes. Yeah, the last one that you missed, man, is the blood circulatory machine. That's the 5th one. Now, I said, can she take all the 4 of them together? So what's the dosage?
Okay. Now, KEDI products can't be taken together, most especially the TCM products. The TCM products, we give it a time. 20 minutes, 30 minutes interval. Now, Rishi, take Rishi 3 times before food on empty stomach in the morning before food.
3 times.
3 times
Okay.
or 2, depending on how severe
Okay.
the case. 3 capsule in the morning,
Okay.
then 3 in the evening.
Okay.
So that is before food. Now, after food, you can take what Godesis, just one capsule after food. Then 15 minutes to 20 minutes time, you can take what Kedi Beta, 4 after food. 4. That means Kedi Beta is twice daily, while Reishi also is twice. Some persons take it thrice, depending on how severe the case. And then cordial jelly, also 3 times, twice. That is 3 capsules. That means cordial jelly, Kedi Beta, and Codesi should be taken after food. Then Reishi should be taken before food. 1 hour or 30 minutes before food.
What about the BCM?
The BCM, actually, the BCM is not, you see, you can't be taking the BCM. And there are some patients, they don't have it, they can't afford it. So they have to go to the maybe the service center to check it, whether once in a week or twice in a week. Yes, that is how.
All right then. So please continue. Keep sending your questions. Keep sending your contributions. I will take them now. But before I do that, let me just leave you with this few announcements. Very soon. Few announcements. Okay, the first one I have here is the third quarter edition of KEDI 2023 Leadership Training will take place next week. Next week at all our training centers nationwide, we will be having our leadership training for all 5-star consultants to 8-star consultants. Please locate the closest training center to attend. Thank you. Entry is free. Now, our 3 fantastic promos are on. They are on. I'm talking about registration are reloaded. I'm talking about our seasonal promo for September to November, and of course our mega product promo. You don't know what these 3 promos are about? No problem. After the podcast, go to any of our social media pages. You will get the flyers. Okay, so go through each flyer and then know the promo condition to participate and win. Please do not miss out. Okay, now we also have a special seminar. A special seminar will be taking place next week too at all our training centers. The schedule will be out tomorrow. Okay, so please do not, trust me, you will be glad. You will be glad you attended. So please do not miss it. The schedule will be out tomorrow on all our social media platforms. It's a special seminar to motivate our distributors. So please do not miss out on it. Okay, Roof, this is the best time to register. You are watching me now, you are not yet a credit distributor, there's no problem at all, no problem. Please, after this podcast, contact the closest credit distributor, get registered, because the best time to register is now. As soon as you register, when you register, you get 1 Kedi Gum Care toothpaste. Now, don't forget our Kedi Car Award promo. 2024 Car Award promo is ongoing. It's ongoing. It will end on the 29th of February 2024. Please jump on this race, participate, because when you start driving your dream car now, you will not share a part of it with me. So please do not miss out on this promo. It's very, very important. Don't also forget that our OPP seminar, foundation training and product training, they hold at our training center. So please go all out to attend these trainings. They are for you. You won't regret attending them, and entry is absolutely free. Okay, you don't know our closest training center, just make use of the comment section, request for referral, and you will be referred to our closest training center so that you can attend these trainings. Trust me, you need them. They are very, very important. All editions of our Parents Inspire magazine, all of them are available at our training centers and our head office. Please pick up your copy. pick up your copy. Now, all our social media platforms are active round the clock for you. If you're not following us on any of our social media handles, you are not doing too well. Okay. On Facebook, we have an account, Kenny Headquarters Lagos. On Facebook, we have a page at Kenny Healthcare Industries. On Instagram, we are at Kenny Healthcare underscore official. On LinkedIn, we are at Kenny Healthcare. On Twitter, we are at Kenny Health NG. Our YouTube channel is at Kedi Healthcare. Subscribe and have unrestricted access to all our videos. Okay, not forgetting our mobile application Kedi Care app. Download the Kedi Care app today to secure your business. Don't forget our website www.kedihealth.com. All these channels are active round the clock to attend to you at any point in time. You need any information, you need to be guided, just make use of any of these platforms and our representatives will attend to you. All right, before I go to the remaining questions that we have, let me take our Dr. Captive for today. Our Dr. Captive says, you can't pour from an empty cup. So, do all you can to take good care of your mind and your body. You want to change the world. You want to do this. You want to do that. You want to do this one and that one. Don't forget, you can't do all of that with a sick body. That's what it means. Please do all you can. No amount is too much to spend on your body or to spend on having sound health, because health is wealth. Please do not forget. Now we leave with these two questions. One is from Barakini Adeyenka on our Facebook page. And please, doctor, kindly list the drugs again for maintaining BP. He just did for a woman age 78. 78. You are watching from Lagos. Thank you. This is for you. Okay, so I'll ask the two questions together. As soon as you answer them, we will call it a day on this edition of Talk to Kedi. So the one from Burkini says to list the products again for maintaining BP. And then I have this one, say what are the causes of hypertension? It did mention them. I guess you are just tuning in again. Okay, so in just 1 minute, just go through these two questions in a minute.
Okay. The maintenance of high blood pressure, if it has not gotten to the secondary stage, where you are having what the primary or essential stage. So we can take golden 6, reishi, and golden 6 reishi, or golden 6 cordial jelly. You can just be taking that with activeness,
Okay.
with keeping active. So these two products for preventing golden 6 reishi or golden 6 cordial jelly to maintain your blood pressure. So whether you have the even the elevated range or the type 1, then you can still manage it by taking these two products. And the causes for hypertension, we have mentioned earlier that one of the causes of what hypertension is a lifestyle. The way we eat, the way we do things, obesity, too much of sodium in our diet, consumption of beverages that contains alcohol, and low level of potassium. So, and the likes, they are much, the list, and even the risk factor of hypertension. These are what genetic factor or age and race is also part of it. So
okay, all right, thank you, sir. So this is where we call it a day on this edition of Talk to Kedi. I guess quite a number of us you tuned in late. Don't worry at all, because we actually did justice to this topic. We talked about the definition, they defined it, the types, the range. We talked about the causes, the prevention, the treatment, the lifestyle, the risk factors. I mean, we dealt with the topic. We dealt with the topic. So if you tuned in late, there's no problem at all. Immediately after this live session, the full video will be on our Facebook account, Kedi Headquarters Lagos. It will be on our Facebook page at Kedi Healthcare Industries. It will be on our Instagram handle at Kedi Healthcare_official. It will be on our YouTube channel at Kedi Healthcare. And then finally, it will be on our Kedi Care app. Okay, so just whichever platform you decide, whichever platform you decide, just sit back in the comfort of your office or your business place and then watch the full video. You get the full gist. Do you understand? Thank you so much for watching. Don't forget that health is wealth. I love you. My name is Sarah Adenowo. See you next edition.